Hey everyone, Dr. B here. Thanks for tuning in again. I wanted to talk to you guys today about what is the right amount of time for treatment and why most treatment programs are 30 days as opposed to, let's say, 60, 90, or any other time frame. So really there is no rationale or reason why programs are 30 days beyond the fact that years ago when insurance companies started to cover treatment for addiction, the most that they would cover was 30 days. And so that's kind of the magic number that's now been adopted by all these treatment centers and has become kind of the norm. The other reason is that because for most people, taking 30 days out of their lives is really a luxury that many people don't have, to leave jobs, families, loved ones, and kind of go off wherever they are around the world to some other treatment center. And so 30 days is already kind of a stretch for people. That being said, you really want to give yourself as much time as possible when you're approaching the process of recovery and trying to get sober. Really what the research tells us is that 90 days gives you a much better chance of success in the long term than a 30-day program or any 30 days trying to change a behavior. So think about it, you're trying to change whether it's 5, 10, 15, 20, 30, 40 years of acting in a certain way within 30 days. The likelihood of that happening is slim to none. I don't care how great the program is. You have such momentum behind those behaviors that you're trying to combat that 30 days is a drop in the bucket. So again, when you're thinking about how to spend your time, money, and resources on a program, you really don't want to just, take all your money and resources and put it in one program for 30 days and assume that it's going to work, because unfortunately the odds are stacked against you that it's going to take more than one attempt. Just in all honesty, the statistics that I've seen in the industry show that within about 40% of people within the first month after leaving treatment will go back to what they were doing, and about 70 to 80% within 12 months of leaving treatment will go back to what they were doing before, whatever drug or alcohol use was like for them. So I say that, just to be aware of kind of the road that lies ahead. Those numbers go down significantly when you are looking at a program that's 90 days or a combination of programs. And what I mean by that is, when you're researching a program, you want to look into what we call a step-down approach to treatment. And so what that means is you want to first look for an inpatient residential treatment facility, which means you're going to spend 30, 45, 60, 90 days at the highest level of care, which is residential inpatient. And then from there, you're going to step down to the next level of care, which is called intensive outpatient, or IOP. And you want to stay at that level of care, which is you can either live at home or you're living at a sober living facility and going to treatment during the day from 9 to 5. Sometimes it's 3 days a week, sometimes it's 5 days a week. You can do evening programs while working or going to school, but you want to go from residential to IOP, intensive level of care, and then to outpatient level of care and continuing to see a therapist to really, keep the momentum going from the treatment perspective and not just go from one extreme to the other. What happens most of the time is people leave their environment, their home environment, go to this, protective bubble outside of, reality, sometimes in Malibu or all these beautiful locations around the world. And then they go back to reality and surprise, surprise, they end up slipping or falling back into their old way of beings because they're around their old triggers and stressors back home. And so you want to have kind of a step down process where you're slowly immersing yourself back into the real world with the support of care around you. So that's the reason why most programs are 30 days, but you really want to, I encourage you to really try to, if you're serious about recovery, give yourself the time to do it right. Really look for 90-day programs with the step down process afterwards, so you only have to go through this process once. Thanks for tuning in, guys. Take care of yourselves and others. Peace and love.